So our session today is going to focus on person-centered care. And the idea of these mini videos is to introduce you to the subject so we can think more about the practical application when we're together in the session. So just that reminder of what we mean by person-centered or patient-centered care. And this, we mentioned last week, is the foundation for that behavioural approach that we began to look at. So I'm going to just tell you a little bit about what we know about person-centered or patient-centered care and some of the policy documents that are relevant to that. So probably the most important document currently is this person-centered approach framework from NHS Health Education England. And they've got a definition here, or an expectation, that patients and the public should be actively involved in all decisions and treatments that affect them and are offered informed choices that empower them and place them at the centre of the care. So that is kind of giving us an idea of what their overall approach is. And someone's going to do a presentation telling us a little bit more about the detail of this document in the session, just to give an idea of what does that actually mean? What do we know about this from this document? What's it going to mean for us? One of the key things that I think we need to be mindful of with person-centered care is that it is effective practice. So I'm guessing that you all want to be good dietitians, not just nice people, but people who can actually enable their patients to make that behaviour change and have improved life and health. So it's really important that we remember that being person-centered is effective practice, and the evidence base for that is getting better. But when you think of the lack of resource that we have in the NHS, it's really important that we use the resources to the best of our ability and to make the best use of the money we've got and the resource we've got. So all of these documents here are all NHS government documents, all talking about different ways that we can move towards making the best use of resource by working in a person-centered way. So the emphasis is that healthcare professionals need to be more engaged with the patients' carers, and with the general public to promote well-being and prevent ill health. So there's that very much health promotion type perspective in it, not just dealing with ill people, but trying to promote well-being generally. So let's just have a little look at something a bit more dietetic specific. And this integrative review of the literature was done back in 2017, so 5 years ago now. But it does summarise all of the literature up to that point in dietetics that mentions patient-centered care. And an integrative review is including both quantitative and qualitative data and research, and it's pulling it all together and doing an analysis of it and saying, well, what are the key themes coming out of that? And what we found was, what the authors found was that there were 5 positive themes. The first 3 really link together. Notice I've highlighted the effective communication skills, and that's because we need effective communication skills if we're going to do the first 2 themes here. If we're going to establish a relationship, build rapport with our patients so that they feel they can trust us and share their reality with us. And also this idea of humanistic behaviour, which is all about demonstrating empathy and understanding to your patient. So you can see that those first 3 really link very closely together. You can't demonstrate empathy or build a relationship with your patient if you don't have effective communication skills. The next thing is about individualising and adapting care. So you can see how closely the dietetic literature links with the general information that we get about person-centered or patient-centered care. So we individualize, we adapt the care to that individual patient needs. And the idea also of redistributing power to the patient, that very much links with the whole idea of giving people control, promoting self-management of conditions. So the idea is that we support people to develop the skills so that they can look after themselves. The concern that came out of the literature, I think, is really important for us to note. So what it was saying, and this is the dietitian's perspective, if I don't have enough time, I don't practice a patient-centered care in the same way. And this comes up in quite a lot of the research, and I certainly found it in some of my research as well, including something more recent than this over the review. And it's the most common reason that I've experienced when I'm speaking to dietitians as well. You know, I haven't got time. That takes too long. And actually, most of the evidence base suggests that it's more effective use of time as well as more effective in leading to clinical outcomes. But while a dietitian doesn't believe that, they are going to go back to a more traditional way of dietetics, which we will not be encouraging, which is telling the patient what to do, because it's perceived to be quicker. It may be quicker, but it's not effective. So how much does this patient-centeredness matter? And this comes from the same paper. And if you look, these words are all words that I have picked up, taken from that paper. So on the left, you've got the patient-centered care and all the things that that's meant to lead to. Remember, this is the patient perspective as well as the dietitian's perspective. So the benefits there, improved relationships, confidence, patients are more confident, as are the dietitians. The care is more appropriate, empathy is demonstrated and received, and it's more effective, but it takes more time. What I really want you to focus on at this moment is looking at what the lack of patient-centered care leads to. Because we often think about the benefits, but don't think about the disadvantages when we're not patient-centered. And this is a longer list and a really important list for us to take in mind. So our patients are disappointed. They find the consultations not helpful. Their preferences are not considered. They feel more challenged by that difficulty in trying to make the behaviour change. They feel overwhelmed. They're discouraged. They're frustrated. They feel as if they've been rushed through their consultation. And most importantly, they don't feel as if they have been heard. They then go away with advice that is not relevant. And that's a really concerning outcome. Because if the advice is not relevant to the individual, they're not going to follow it. If they don't follow the advice, their health is not going to improve. So we really need to be mindful of the impact of not being patient-centered to try and help us steer away from that to be patient-centered as much as we possibly can in our practice. So what does patient-centered care look like in dietetics then? The same authors have developed a tool to measure patient-centered care, and they have started the process of validating that tool. So what does a tool need? It needs to look at how we are being patient-centered in our consultations. From their research, they found that means we should be doing shared decision-making, which makes complete sense. And we're working collaboratively with our patients. We need to be holistic and individualized. Word keeps appearing again. We need good communication between ourselves and our patients. We need to get to know our patient, and we need to be caring, which again you might remember from last week was one of the key things that has to be part of how we function if we are going to deliver patient-centered care. So we've got that mixture there. That's what patient-centered care should be looking at. Now these authors have looked at views from dietitians and patients. They need a bit more validation work doing on this tool, but it's a really good starting point for us to consider what we need to look at if we are being patient-centered in dietetics. And the shared decision making might also include something that's come up in the most recent curriculum framework, which is about setting the agenda for the consultation together and communicating so that we're on the same page, we've got the same goal for the consultation. Just to spend a little bit of time thinking about the importance of communication skills for delivering patient-centered care. There are numerous policy documents and research papers emphasising the importance of communication skills in healthcare, and some of those will be reviewed and presented in the session. But if you look at this long list of references, we've known for years, for decades, that the skills of the practitioner, that's the dietitian, are important for helping people to change their health-related behaviour. So we've known that nearly 30 years. The importance of communication skills of healthcare staff has been recognised now well over 15 years and been in policy and in NICE guidance. But those 2007 NICE guidance were really quite revolutionary in my mind for putting this important area of communication skills on the agenda. So all of that is the national guidance, including the guidance for us as dietitians and including healthcare guidance from the Health and Care Professions Council. There's been this growing interest in developing skills and how we do that to promote health-related behaviour change. And there's been some really good papers as well that have looked at the person's and patient-centred perspective from the patient's point of view on what they think. And clearly some of those were included in that review that I've talked to you about. So the communication skills seen then as foundation to the person-centred care, which is essential for the behaviour approach. So we also need to think about what happens when people do not experience good communication in healthcare. And there's a few things here that I think are really important for us to consider. There is significant disagreement between the patient and the professional perception of what actually happened in a consultation if there's not good communication. So there's been a couple of papers that have looked at that. And that's really important because if people go away having a different understanding of what happened and what was talked about and what was agreed, then they're not going to go away doing what you think they're going to do, and therefore their health-related behaviour change is not going to happen. If we don't build rapport, we don't find out the patient's feelings and concerns. And again, that's quite well recognised. And our patients go away much less satisfied. So have a think about how that impacts on what the patients are going to go away and say about our service, but also how motivated are they going to be? Have we improved their capability to change behaviour? And if they've not had good communication, they've not felt that their needs have been heard, the answer is that's not going to happen. They're not going to be more motivated, they may be less motivated. They're not going to have increased capacity, they may have less because we haven't helped build their self-confidence, we haven't helped build their empowerment, we haven't empowered them. So in the next session I'm going to carry on and just talk a little bit more about this.